This is very interesting case, isolated case of left ventricle non-compaction. So non-compaction cardiomyopathy, this is the scenario. So this is apical fourth chamber view, this is left atrium, this is left ventricle, right atrium, right ventricle. Minimal pericardial effusion also. In this image, this is apical fourth chamber view. So obviously a structure, this is left ventricle, this is right ventricle, this is left atrium, this is right atrium. So what you see the interventricular septum. This interventricular septum is having some sort of breakage in the continuity. You see there how the, so that made me to find out other part, analyze the other part, so that I can find out what is the real pathology behind this image. So now the next image, this is short axis view. You see that this portion is very much thickened, but this portion is very much thin. Again, you see this is the parasternal long axis view. This is left atrium, left ventricle, aorta, left atrium, left ventricle, aorta. This is minimal pericardial effusion. You can see this portion is thick, this portion is very much thin. At the same time, you can see that one this crevices, this is a space between two muscular bands. This is going inside the interventricular septum, anterior septum. So that made me think out where there is global hypokinesia also. So what is the problem with this patient? So the next image, you see this portion is very much thin, but lots of trabeculae and intertrabecular space that is going, and this compact portion, this is non-compact portion, this is compact portion. This portion is very much thin here. This is inferior wall. So in most scenario, the inferior wall and apex is, or lateral wall, most commonly involved. So this portion is very, you see this portion is spongy portion, lots of trabecula and this intertrabecular space. So this is the case of non-compaction cardiomyopathy. The rare finding, rare case. So this case has already developed left ventricular systolic failure. You can see this inferior portion of left ventricle, inferior wall of left ventricle, and lots of muscular bands and a space between these two, and that space is communicating with left ventricle chamber. You see the blood flow into left ventricle because the flow velocity is less, that's why blood flow contrast is easily seen in this image. You see again the same thing. You can see there's lots of muscular band and very thin compact wall. The ratio wise, if it is non-compact portion is more than 2 times compact portion, then it's called non-compaction cardiomyopathy. But in this case, you see the scenario, the compact portion is very, very less in this scenario, and whole portion is non-compacted. Even 3:1 ratio. 3 portion is non-compacted, that is a spongy portion, and 1 portion is compact. So this is the case of isolated non-compaction of left ventricle, that is non-compaction cardiomyopathy. You can see the blood is communicating here. You see this is pericardial effusion and flow, that is color flow of the fluid of pericardial effusion also. So this is also the color flow, that is because of fluid moving within pericardial space. But what you see, this crevices, this space is also getting blood from left ventricle. It means it is communicating with left ventricle. You can see in this image. Global hypokinesia, you can see this portion is very much thick, but 1 portion, this portion. Again, you see this inferior wall is very much compact, is very less, and spongy layer is very much amount. You see, this is the case of isolated case of non-compaction cardiomyopathy. LV non-compaction cardiomyopathy. This is IVCs compared to aorta, obviously almost same size. It means it is dilated. Again, short axis view of left ventricle. This is left ventricle, this is pericardial effusion, and this is inferior wall of left ventricle, and this compacted layer is very thin, and this portion, this is a spongy portion, non-compacted portion. prominent muscular bands, that is called trabecula, and intertrabecular space, that is communicating with left ventricle. So this is left ventricle non-compaction or non-compaction cardiomyopathy. Thank you for watching this video.